Hello, my name is Lindsay Hammer, and I'm going to be a freshman at The Ohio State University, and I was in the science internship program this summer. And my project is hip arthroscopy in adolescents, predictors of prolonged recovery. Hip arthroscopy is a minimally invasive surgery. A very small incision is used to look inside the hip joint. Hip arthroscopy is a diagnostic procedure which relieves symptoms such as a limp, passive range of motion, clicking, popping, snapping, or pain. The diagnosis can include a labral tear, loose bodies, synovitis, and chondral lesions. This is the inside of a hip, the hip joint. And this is the labral tear. And this is the repairing the labral tear, shaving it down. And this is afterwards, what it looks like. The purpose of this study is to develop preoperative predictors of a prolonged recovery in people ages 27 and under that are undergoing hip arthroscopy. This is an extension of a study done by Ho H. Lee on hip arthroscopy in adults. Predictors found were workman's compensation involvement, female gender, use of pain medications, a limp, and a lateral labral tear. To do this project, hip arthroscopy patient charts were reviewed in Epic. Information was sorted, examined, and put into a database to find possible trends. And the study included patients aged 27 and under who have received hip arthroscopy between January 1st, 2003 and June 15th, 2011. And my data is 206 patients were analyzed, and the stats for these patients included the age in the cohort ranged from 9 to 27 years old, 71% are women and 28% are men, 114 are right hip arthroscopies and 92 are left hip arthroscopies, 104 patients experienced mechanical symptoms in addition to pain, and preoperative symptoms range from 0.25 to 168 months in duration. Now this is my data for preoperative treatments, physical exam findings, radiographic findings, intraoperative findings and diagnosis, onset of pain and symptoms, and 79% of patients presented no chondral lesions. And as the severity of injury increased, the frequency of occurrence decreased. Only 3% of the patient population presented grade 4 injuries, such as osteochondral lesions through the subchondral plate. 28% said that their last follow-up was symptomatic, 28% of the patients, 59. And 71% said that their last follow-up was not symptomatic in EPIC. And 31% had their recovery was prolonged longer than 2 months, 64 patients that is, and 68%, 142 patients, had said that their recovery was not prolonged longer than 2 months. And my conclusion is preoperative physical therapy may prolong postoperative recovery after arthroscopy for labral tear. And intraoperative findings of significant synovitis and lateral or posterior inferior labral tears are associated with prolonged recovery after arthroscopic debridement. Based on these results of the study, doctors should not advise physical therapy prior to hip arthroscopy. These are my sources. And I would like to thank my mentor, Dr. Goodwin, Christopher Utz, and Allison Klieka, and especially the Office of Civic Education Initiatives.